Australia's booster program won't be fast-tracked for now as Australians are urged to wear a mask indoors ahead of Christmas. For more, let's go live now to Canberra where Trudy McIntosh joins us. Good afternoon to you, Trudy. Certainly lots to unpack after this emergency meeting of National Cabinet.
Yeah, there certainly is. And let's begin with the booster program across Australia. Ahead of this snap National Cabinet meeting that the Prime Minister called today, it was a focus on whether there needed to be a fast tracking of the boosters. States like South Australia leading the charge, arguing it should be brought forward from a 5-month delay from your second shot back to 4 months. That's not been the advice yet from Australia's immunisation advisory body, ATAGI. The Prime Minister says that's who he's going to listen to on this matter. They are meeting this afternoon, though, and we could potentially see a change in the lead up to Christmas. Here was Scott Morrison.
There's been plenty of discussion about whether the interval should be 5 months, 4 months, 3 months. That will be a decision for the vaccination experts at ATAGI. That is not a decision for myself as Prime Minister or the Premiers and Chief Ministers. The interval will be what the immunisation experts advise.
Now, this National Cabinet meeting was called for today so states and territories could get on the same page about the health advice when it comes to the Omicron variant. The news is that it's more transmissible than we've seen with other variants, but the Chief Medical Officer points out that so far, during the 4 weeks or so we've known about this variant, there's only been one person in ICU in Australia as a result of Omicron. In terms of how we manage it going forward, though, the Prime Minister says expect to see more cases. They're going to keep a close eye on hospitalisations. But in order to try and slow the spread, they're looking at additional measures, including masks. But the PM has stopped short of what the health advice had been leaked ahead of National Cabinet from his own Chief Medical Officer, Paul Kelly, that a mask mandate indoors should be implemented across the country. Scott Morrison says people don't need to be fined in order to wear a mask.
Mask wearing in indoor spaces in public areas is, of course, highly recommended. Whether it's mandated or not, that's what we should be doing. In the same way as we go into this summer season, people will be slapping on the hat and slapping on the sunscreen. There's no rule or requirement to do that, but it is strongly recommended health advice. It's in the same category.
People should wear masks. How that actually comes to be is a matter for states and territories.
What is the health advice?
The health advice is wear a mask.
Can you tell the states, though, that they should mandate that in indoor settings?
I've said that mask use should be used because we know, firstly, it works, and secondly, to protect yourself, to protect others, and secondly, it doesn't interfere with social gatherings, economic and so forth.
And Trudy, the Prime Minister says Australians shouldn't have to get a COVID test to travel interstate.
Well, they shouldn't have to, but that's what's happening for a lot of people ahead of Christmas. In a lot of states, Queensland, Tasmania, South Australia, Western Australia and the Northern Territory, they're all requiring fully vaccinated visitors, if they're coming from New South Wales, the ACT or Victoria, to have this PCR test at least 72 hours before you arrive. Now, that's led to these long queues that we've seen at testing clinics. Scott Morrison's made it clear he believes it's unnecessary, but at today's National Cabinet, he was unable to actually sway anybody, these premiers, to do anything about it.
Why should Australians who don't have any COVID symptoms have to test at all to go across state lines?
I think that's a very reasonable question. Some states are still of the view that they are requiring that and are seeking further medical advice on why that should be withdrawn. About 1 in 1,000 people who are being tested who are travelling are proving to have a positive response. For those who are close contacts, that's 17 to 20.
The Prime Minister argues the proof is in the testing numbers that people who are asymptomatic and getting this because they have to travel across state lines aren't testing positive in the same numbers of people who actually have symptoms. States will not meet again with the Prime Minister now, Julie, until the new year, but it seems like, as we've seen with a lot of these national cabinets, they leave today as divided as ever.
And just 3 sleeps until Christmas. Trudy McIntosh, thank you for that update live in Canberra this evening.